And hey, everybody, and welcome to another ODwire webinar. It's Adam Farkas along with
Paul Farkas here.
So I dragged Paul into the studio tonight because I know that this is a topic that is near and dear to his heart.
I know, really, it's after my bedtime, but I'm here anyway.
So tonight we got a great show for you, all about the brand new, and you know how much we love new product launches, but it's the new one-day ACUVUE Define lens. And we have two experts on the line with us tonight who are going to talk us through how to implement the lens in your practice and really build your practice around this particular lens. So we have Dr. Susan Resnick from New York, and Dr. Patricia Poma from just outside Detroit, Michigan, in Birmingham.
So before you start, we have to have full disclosure, though, about Susan Resnick.
Oh, yes.
Absolutely. I met Sue when she was Sue Resnick, teenager, and she was a patient, a contact lens patient that came in, and Sue not only became a patient, but she went on to optometry school, worked in the practice as a technician, and then on after graduation became an associate, moved into a partnership, and now at the present time, it's Dr. Susan Resnick, not only partner, but head honcho at the practice. So Sue, that's actually
kicked your butt out the door. So both Sue and Patricia are experts in contact lenses, which is the most important thing. And even more importantly, they've had experience with this lens in their practices already. So even though this lens is new to market, they've been working with it for a while.
Right.
So I can't think of two better people to sort of walk us through how the lens works and how to implement it in your practice. And we also have on the line as well as sort of a bonus from Vistakon, the folks who make the lens. We have Elizabeth Curl-Starr, who she's going to take us through I think the first few slides to give us a little background about the lens itself and talk to you a little bit technically about it. And then we'll get into some good Q&A. So if you have any questions, on the right side of your screen, you should see a big box on the right that says Q&A. Feel free to type in there. I'll get all your questions, and then as the lecture unfolds, I'll hold those questions aside, and then I can ask our speakers at the end. So with all that out of the way, why don't we get started? So Elizabeth, do you want to sort of get us kicked off here and tell us all about the lens?
Yes, absolutely. So I will be relatively brief. I'm definitely not the focus of this evening, but I wanted to make sure that anyone who is on the webinar that hasn't had exposure to Define yet has a base understanding about the lens and what this is. And when we talk about one-day ACUVUE Define, we're thinking about this as a lens that is really in a category entirely of its own. It's a new natural eye-enhancing lens that provides a beauty benefit for the eye that's different than anything that we've had in the U.S. marketplace. And we think it's got the potential to really delight patients and provide something new and exciting for you to talk about in your practices. So Adam, would you mind advancing this slide?
Sure.
And everyone on the phone is very intimate with the eye, and you all know that eyes are really what we look at when we're evaluating others, when we're listening to others. And there have been studies across cultures around the world over many years that have really proved out that when we're evaluating others and their appearance in particular, the eye is really what we focus on. In fact, 80% of our attention and 80% of what we attribute beauty to is really based on the eye. So it's a really important feature when it comes to how we're evaluating others and their beauty in particular. Moving on to the next slide, please. But then when we look at the U.S. and we think about what we have in the marketplace today to really enhance the eye, to draw attention to the eye, the bulk of what's available is really enhancements for around the eye. So eyeliners, mascaras, eyeshadows, things that help bring attention to the eye, but there hasn't been a product that really enhances without changing the iris itself, which is obviously a very critical element to what makes the eye beautiful, and it's really going to bring attention to an individual's face. And next slide. And so that's why we're excited to introduce one-day ACUVUE Define. It's a completely new type of beauty product that really enhances the iris, brings out the natural beauty of the eye, but in a way that's different than what you might have experienced with cosmetic lenses in the past, because this is not about covering up or masking the beauty of the eye. Instead, it's really about enhancing what's already incredible that's happening in the iris itself. So there are 3 effects. Note that we call them effects, not colors, because these effects, they don't change the color of the eye. They really just enhance the eye. But there are 3 effects that are part of the One Day ACUVUE Define portfolio. You're seeing them here from the left. We have natural sparkle, which is the lightest, the most subtle of the 3. Natural shimmer in the middle, which is sort of a middle impact lens, and then natural shine on the edge, which on the right side, which is the most dramatic but still very natural of the lenses, and a lens that tends to be worn by people who may have darker eyes. As you look at the patterns on these lenses, there may be some things that you notice are different from other contact lenses right away. For example, the patterns aren't at all pixelated. They're really iris-inspired and designed to play up on all the really beautiful fibers and textures that are already occurring in the eye. Additionally, the pigment is really limited to the periphery of the lens, again, because these aren't changing the color of the eye. There's no need to bring that pigment in close to the pupil. It's really about adding some extra definition, highlight, texture, and enhancement to the eye. There are a few design elements that I want to make sure that folks are familiar with before we take a look at what these lenses look on eye. The first is that all 3 effects provide a really clean edge right at the limbal ring, and a little bit of a darker pigment at that edge as well. And what that's going to do is create some added contrast between the iris and the sclera, making the eye pop and actually making the white of the eye appear a little bit whiter and brighter. Just within that limbal ring, you'll see some highlights, these really iris-inspired highlights that look like the natural occurring filaments and fibers within the eye. These are translucent highlights, so they're not going to cover up the eye, and in fact, on a light eye, they're really designed to let those already very beautiful textures shine through. And then on a dark eye, these highlights just add a little bit of the texture and dimension that tends to be missing when you've got a slightly flatter, dark eye. And then I referenced earlier that the pigments in these lenses don't come anywhere near the pupil. So on the right here, you can see that the center optical zone is transparent and clear, which means these lenses are going to provide vision very comparable to what you see in a clear lens today, and without the compromise that you may have had to have your patients go through if they've been wearing a colored contact lens or other cosmetic lens in the past. So those are just some of the features of the lens. The common pieces, again, are a defined limbal ring that's going to create some extra contrast and definition between the iris and the sclera. These iris-inspired highlight patterns that allow the natural eye to shine through but add some extra texture to the eye. And then lastly, that clear optical zone that really helps this lens perform very similarly to a clear lens. Next slide, please. And we talked about the limbal ring, and this is something that I know all of you are familiar with. But what was new to us, there's been a lot of research over the years to understand what is the role of the limbal ring, especially when it comes to beauty. So there's some third-party research out there. I encourage anyone who's interested to Google it. The research was done by a gentleman named Darren Peshek out of the University of California at Irvine. And he did a study where he compared identical faces, where he photoshopped a limbal ring onto one face in a pair, and then removed any limbal ring on a face in the other pair. Then he had men and women of different ages, different ethnicities, look at these facial pairs where the only difference was the presence or absence of a limbal ring, and to evaluate them for beauty, for youth, for health, and attractiveness. And what he found was consistently that men and women, when looking at men and women in these facial pairings, chose the faces that had a more well-defined limbal ring as being more attractive, as being perceived as more youthful and more healthy. And that's probably because the limbal ring is something that's very pronounced at infancy. If any of you have children or grandchildren, nieces or nephews that are very young, if you look at their eyes, you'll see that they have these really beautiful, wide, very bold limbal rings. But those tend to fade as we age, particularly starting in the early 20s. They tend to fade, and they can also fade with age and disease. So subconsciously, even though many of your patients have no idea what a limbal ring is or why they would want one, we're all sort of subconsciously wired to perceive this feature as something that's a signal of youth and health and attractiveness. So that's part of the benefit of that limbal enhancement that One Day ACUVUE Define provides. Next slide, please. So now we'll take a look at a few pictures of the lens on eye, and I want to make a statement that there are no pictures that really do justice to what this lens looks like. So if you haven't seen the lens on an eye, I encourage all of you to try it on yourself, on your patients, on your staff, because these lenses really, they play uniquely with the eye and light, and the images never quite do the lens justice. But if you look at these images, on the left you can see that there's a beautiful bluish-green eye that's wearing no contact lens. In the middle, you see the same eye now wearing a one-day ACUVUE Define in the sparkle effect, which is the lightest of the three effects. And then on the far right, you see just a close-up of that sparkle lens on the eye. And hopefully what you'll notice is that there is some extra definition, a nice clean, clear line between the iris and the sclera. And then a highlight pattern that's really just playing up and bringing out some of those beautiful blues and textures in her eye. But it shouldn't look unnatural, and because the pigments are translucent, they actually allow the light to reflect both in and out, giving a very natural appearance compared to some of the opaque lenses that you may have worked with before. Next slide, please. Now we're looking at a kind of medium brown eye. Again, on the left, no lens. In the middle, she's wearing our shimmer effect. And then on the far right, just a close-up of shimmer on eye. And again, what you'll see is obviously we're not changing the color of the eye, but we are helping that eye really to pop, to stand out, to look like it has a little bit more interest, texture, depth, and dimension, as well as that well-defined limbal ring that's creating that really nice, clean contrast between the iris and the sclera. And the honey-colored highlights on this lens are almost creating some gold flecks that really pick up especially well in natural light and just add some extra pop to the eye. And next slide, please. And then lastly, this is a look at natural shine, which is the most dramatic of the effects. But as you can see from these images, it's still very subtle, very natural looking. And this lens, again, defines that limbal ring around the iris, in between the iris and the sclera. And then this has a slightly different highlight pattern that allows a little bit more of the natural color of the eye to come through, but still adds those honey-colored highlights to add a little bit more interest to this beautiful brown eye. Natural shine is also a lens that has a slightly wider printed diameter. So this is a lens that's actually going to cause the iris to appear a little bit bigger than it would if someone was not wearing the lens. And if any of you have been aware of Define before we launched it in the U.S. in March, it may be because we had launched the lens about 10 years ago in Asia. And this natural shine effect is actually one of the effects that's been in Asia for several years now and was really designed to bring out and define a darker eye. Natural sparkle and natural shimmer, the two effects that we looked at before, those were really designed for the Western market, where we needed to accommodate for a broader range of eye colors and needs in the marketplace. But across this portfolio, you'll see that with three effects, we have ways to beautifully enhance a range of eye colors. And these lenses really can work on a range of eye colors. Personally, I have kind of lightish blue-green eyes. I wear both sparkle and shimmer. I know people with hazel eyes that wear shimmer and shine, and then brown eyes often like shimmer or shine. Because those pigments are translucent, because the patterns are really limited to the outer periphery of the lens, they blend beautifully, seamlessly, and uniquely on every eye, and you'll find that these lenses do look a little bit different on every eye that you try them on. Can we move to the next slide, please? And what's really phenomenal about Define, in addition to the fact that it provides this new benefit, this natural beauty benefit, is that it's built on the One Day ACUVUE Moist platform. And I'm guessing everyone on the phone has had at least some experience with Moist. It's the #1 prescribed daily disposable in the world. And it's a phenomenal product that I'm sure you're seeing great results with your patients. The One Day ACUVUE Define is built on the same platform as Moist. And because the pigment is completely enclosed within clear layers of the lens, and because that pigment is printed on the periphery of the lens, we see clinical performance that's very comparable to what you'll find in a one-day moist clear lens. You can see the numbers here that there's consistency in fit, comfort, vision, and then, of course, the Class 2 UV blocking that you could expect from Moist and the UV blocking that you would expect in any ACUVUE brand contact lens. One note to call out is that some of your patients may experience a slight difference in subjective vision with Define versus their normal lens or a clear, moist lens. And that tends to be attributed to kind of a peripheral awareness to the pigment in the lens. And that's something that will likely go away as the patient wears the lens for a few days and gets used to it. And I know that Drs. Poma and Resnick will also speak to some of the experience that they've had with the lens. So really phenomenal clinical performance coupled with this natural beauty benefit. And I know that your patients probably aren't asking for a lens that defines their eye or creates a limbal ring yet. But if you allow them to try it, to see it, and how it really naturally enhances their eye, I'm confident that it's something that they'll really love and that you can feel good prescribing because you've got performance that's very similar to one-day ACUVUE Moist. And moving on to the next slide, please. And then here are some real responses to the designs as patients have tried the lens, and you'll see that patients love this natural effect that nobody is going to guess is anything but an eye that they've been born with. They like the fact that it looks very natural, effortlessly beautiful, brighter eyes that are fresh and well-rested. These are the kinds of things that you can expect your patients to say as they try the lens. And this is not a lens that's really designed for somebody looking for a dramatic color change. Instead, we think it's a wider market that's looking for natural enhancement of a feature that they already find very beautiful. And I think with that, it is time to turn it over to the real experts on this call. So Drs. Resnick and Dr. Poma, who have been working with the lens for several months now and really want to provide some best practices and tips in their own personal experience with the product.
Great. Yep. So I guess what we should probably do is just maybe go slide by slide and just talk about how we can implement this product in your practice. So I guess the first slide speaks to establishing an effective office process. And so why don't we start, Sue? Do you want to sort of kick it off here?
Yeah. So the one thing that we do in our practice, and we've learned this early on, is that unless our staff is really excited and educated and on board, we can't convey the enthusiasm to the patients that we want. I mean, I can do it as much as I can in the exam room, but unless the staff can really run with it, it really won't take off. So we started by just having a lunch and learn, and where, I just sat down with my staff, and I think our rep came in as well, and everybody got to try on the lens, and then we basically did the presentation that Elizabeth just did to really give them ownership of the technology and of the lens, and so that they could understand it on themselves. And so once that was done, then what happens is I actually bring it up first to my patients. I have the type of patient population that as much as they really need the reinforcement from the staff, we gain more traction when I bring it up first in the exam room. And I just pick a few keywords, which I'll share with you in a moment. And once I've done that, now my staff can take it from there and explain a little bit more. I don't have them put the lens on in my exam room. They actually put it on either in our application room. But I've actually learned now what's working nicely is I actually have them go into the optical and try the lenses on, and that accomplishes a couple of things. A, it gets them into my optical, but B, it also lets them now start looking at different color frames in conjunction with their new eye color, so it really creates a buzz in the office. So what I will do is, once I've done the exam with the patient, and of course you want to do this before dilation because once their pupils are dilated, you really can't judge the color. So I'll do the basic exam, and I'll say, your eyes, your prescription is this, or it hasn't changed, or we're going to do this. And I'll say, before we get to the more serious stuff, let's have a little fun. And, there's a new product now where we can make your eyes look a little more vivid or pop a little bit or accentuate them, whatever adjective I'm going to use that day. I don't talk about it being a colored lens. I just talk about it being a lens that's going to make them look more awake or more intense. Whatever word I think matches the profile of that patient. And I think all of us know our patients' personalities, and you can really tailor your verbiage to that patient. And, I'll bring them then into the tech room, and I will tell the techs to choose just two of the variants because I pretty much know what I'm going to choose based upon their natural color. And they will put the lens on one eye, and compare it to the natural color, and then they'll put the second lens on the other eye and compare the two eyes between the two colors and decide which they like, if not both. And many patients will like both, or if it's one more than the other. And then basically we'll just go ahead and give them some trials to, wear for a few days. But if everything looks really good in the office, we'll just order them right then and there. I will, however, see them back in my chair just to check the fit and the vision. And then then the lenses can come out, and if I have to put dilating drops in or whatever special testing they'll do, we'll do at that time. So it really can be efficiently done without too much chair time. And again, the technicians are talking them through it, and even the technicians were trained to do it very quickly. Because I think the inertia for me, and I'm sure for many of the docs out there, is, okay, we have so much to do, we have so many patients to see, how are we going to make time for, something that's not so serious? But the patients really appreciate the not so serious. They do want to have a little fun, and it does lighten it up and make the appointment a little more fun for them. So we've actually, encouraged our staff to, use this time to get the patient at ease and, introduce them. If they haven't worn a lens before, it's a great opportunity to even introduce them to the concept of having a lens for part-time wear. And even patients who have not been in daily disposables before, it's a wonderful opportunity to have them put the lens on and then share with them that this is a daily disposable. So it can open up practice benefits on a couple of, different angles.
Sure.
So I have a question, Sue. Do these replace the lenses that they have usually, or do they use them as an adjunct?
Well, you can go this way. It depends upon the patient. It depends upon their prescription. It depends upon how old they are. So, yes, for many patients, it can be their primary lens. And certainly, if I have a 22-year-old in the chair who's a -3, there's no reason this can't be the primary lens. There are patients where it might just, if they're a weekend warrior and they're wearing their glasses, certainly this will just be their go-to weekend lens now. But if it's a more mature presbyope who might need the one-day multifocal during the week or for work, they might wear the multifocal during the week and wear the color, on the weekends, in which case maybe, do a little monovision for them, or, if they have a little bit of still that may not be appropriate for them for their primary lens, but certainly is acceptable to them to have fun, it would be a secondary lens. They have to look at the visual requirements.
Right. And Patricia, so has your experience been similar in terms of working the lens into the process of your office?
Yeah, I like to bring up the conversation myself in the exam lane. I find that it doesn't take a lot of time. Also, I agree with Sue in many aspects. I find that a lot of doctors, though, aren't very comfortable with prescribing or getting excited about the lens themselves. Particularly male doctors, I think they feel a little bit uncomfortable sometimes talking about a beauty lens. So I talk to some of these doctors across the country, and I talk about maybe, how to get staff involved. And one of the things I tell them to do is have their technicians get involved, and maybe to ask every spherical patient that walks into their office and ask them, would you like a lens that makes your eye, whiter, brighter, less tired, enhances the natural beauty of your eye? And one thing that I also advocate is that, we all have marketing dollars that we use in our office. So some of us, use them for postcards or newspaper ads. I think that it'd be great, and one of the things I do in my office is I use some of my marketing dollars to, to have one staff member, the person who's most excited usually, to wear the lens in one eye so they can kind of show an example of what it looks like, so that when patients ask about the lens, they can kind of see the effects, that they see that it's you, I call it you only better. So an easy target, patients that are super easy target are the ones that come into your office wearing makeup. I always laugh when when a woman comes in wearing eye makeup to my exam, because they know they're getting dilated, they know they're getting tonometry done, but yet they come in with a full eye makeup. I know that that's the patient that cares about the way they look, and I know that that's the patient that's going to get super excited about the lens. Beauty is usually impulsive, so patients that come in wearing makeup that care about the way they look, they're ones to really get excited about something that's new and innovative that's going to make them look better, and they're usually the ones that purchase the year supply that day. The other thing I do that may be a little bit different is, I love the one-day moist modality. I love the technology behind it, the comfort. And so I fit a lot of my new contact lens wearers in the one-day moist. And so sometimes I just throw in a couple of the, sparkle, shimmer, shine. And I don't really say much to the patient, but it helps them with handling. So in the beginning, they love, trying the lens on because it helps them with handling. But then we have them step back and look. And more times than not, they'll purchase, clear lenses, but also add in a few boxes. I also agree with Sue about the weekend warriors. A lot of times people don't really know that they like this lens, and they get a box or two, and they say, I'll just put these on for special occasions. And then they find that they like the way they look with the lens. And I've had patients actually want to return, the rest of their annual supply and exchange them out for Define because they love the way they look, and it's almost a letdown when they take those lenses off. So they find themselves almost becoming addicted to the lens, if you will. So I found that very interesting. They thought they were just going to wear them, for special occasions, and every day kind of became a special occasion.
Right. Great. Well, let's move on to the next question. So Patricia, you kind of just brought it up a second ago, identifying that target. So you mentioned a lady who comes in wearing full eye makeup, so that's kind of a gimme. But can you speak a little bit more? I guess, Patricia, why don't you just lead off since you started with us?
Sure.
Why don't we just talk a little bit more just about perhaps, so we know that's the ideal patient, but who else? Who else would you actually look at?
Well, I'm going to talk about the patient that most people don't think is ideal, which is the man. We always think of this as the fashion-forward female for this lens, but, I kind of experimented with this in my office because I thought to myself, today is the day of the metrosexual male. Men are spending more money on beauty products than they ever have. And so I thought to myself, what would a man want out of this lens? Why would a man wear this lens? And, the words I use, I kind of target men that have jobs that, sales positions, for example, or lawyers. And I kind of, I wasn't really sure what the reaction would be, but I use words like commanding and empowering. And so I'll say, I explain to them how, their jobs require much eye contact and they want to maybe dominate a conversation. So, when you're wearing this lens, your eyes are drawn towards the eye, and people in sales, like that. They want the attention. They want their face to be the focal point so they can, sell something. And so men have been actually pretty responsive about it. Lawyers, the same thing. I had a patient tell me once that, he wanted a pair of glasses that were very bright, that very, like a focal point because he wanted the judge to make eye contact with him. He wanted the judge to see him. And so, I've been telling lawyers about this lens also, and they've been trying it on because it really, gives their eyes just more attention, and that's been very helpful.
Huh. Interesting. Sue, have you had the same experience in Midtown Manhattan?
Exactly the same. I'm sitting here laughing. That's exactly what I do. So definitely lawyers, anybody who is doing presentations, people in sales, people in marketing, where they're doing a lot of face-to-face meetings. I've also, believe it or not, I have a lot of dentists that I put into this lens because when the patient is laying back in the chair and you're staring at the dentist's eyes, even though they might have the protective glasses on, they really love it because they're like, people, they're looking at my eyes and finally, they look nice. So I do have a number of dentists wearing it, but I agree. I've done the lawyers. I've done my salespeople, my marketing people, my CEOs, anybody who I know has a job where they have to be, face-to-face with people or command attention. And it's very easy. We talk about the women that come in wearing the makeup, but it's very easy to identify a man who is, fashion forward, and also in terms of their own personal care. I mean, there's a lot of men that come in and they're, you can tell they have manicures, they have clear nail polish on. You can just tell by the way they're groomed. But at the same time, I don't actually let it exclude me from not bringing it up with other people because you can't, always judge by the cover. And so I will bring it up often to people that you might least expect it. Maybe somebody who I feel is a little shy even. Because much the same way with kids, we know when we get kids into contact lenses, their self-esteem improves. So I've actually taken a few men who may have been recently divorced, or I know who maybe are in the market, if you will. No joke. And I'll just frankly say to them, how would you like to, get some, have your eyes grab a little more attention in a nonverbal way. And I think this goes back to some of the other studies, because are verbally shy, and they're like,
do you have a pet name for this? Like, every second person that comes into the office has dry eyes. What would you call eyes that could be improved by this lens? Would it be sad eyes or tired eyes?
No, just maybe, obviously they called it a one-day define for a reason, and it does definitely give the eyes more position. And, if you can, grab somebody's attention in a nonverbal way, I think it's very empowering.
Well, I would also like to just make a statement on behalf of all, dumpy middle-aged men that when I went to Expo East, J&J had a big display set up where you could try the lens on. And I admit that I felt faintly ridiculous doing it because that's just me. But once I got the lens on, I'm like, okay, yeah, that actually looks pretty good. So there's hope even for the least of us is what I'm trying to say. Maybe not for you, Paul.
There's no hope for me, but okay.
Yeah.
I was going to mention two other candidates that I found that this lens is really successful for. Patients who have, arcus of the cornea. This lens does an amazing job in making those eyes just look so much younger, more vibrant. A lot of times we don't think of that demographic for wearing contact lens, but they're the ones that have almost the biggest impact. I mean, it's instantaneous, and they, patients will tell me, you just took me, these are my eyes from 20 years ago. And they really, especially blue-eyed patients, they really, really don't like that their blue eyes aren't as vibrant as they used to be. And then if you have someone with dark brown eyes and has arcus, it just covers it up so nicely. I mean, obviously these lenses aren't indicated to treat any disease or anything like that, but the effects are just wonderful. The other thing I wanted to note was, I always try to advocate contact lenses to many of my patients, and a lot of people will tell me that they don't want to wear contact lenses because their glasses hide the bags under their eyes. And so that tells me that they're conscious about the way they look. So you never want to discount the fact that just because someone wears glasses or just because their prescription's outside of the parameters of this lens, that they don't want the attention to their eyes, or they don't want, their eyes to look more vibrant and youthful.
Right. Great. So let's move on to the next one here. There we go. So here are a whole bunch of statements, and perhaps you guys can tell us if these are anything that you use, in terms of the verbiage to get people to inspired to give the lens a try.
I don't use eyeliner. I compare it to mascara, and I would say it's only better. I explain to people this lens is like a mascara that will enhance your natural beauty. Mascara doesn't change the way they look, but there's a reason it makes it bolder. And when you use that effect, it kind of gives them an idea that this lens, it's not a colored lens, but it's going to just make them look more vibrant.
Right.
Yeah, I do the same. For a lot of women, they go to they go to the gym, and they'd like to put makeup on, but they know how ridiculous that is because, you're perspiring and it's a mess. So I always bring it up, and I say, how would you like to look a little bit, more made up without the makeup and look a little bit more awake at, times you may not feel so awake. And then that's how I introduce the lens.
Very good. And in terms of describing the benefit of the lens, we can see a whole bunch of quotes up on the screen right now. So again, is this the sort of language that you like to use with your patients?
Yeah, and the other thing I would say, though, Adam, as much as this language is important, and certainly you want to give a little description, I also found that too much description can work against you because, as Elizabeth alluded to before, this lens has a very unique and individual effect on each eye, and it doesn't do the same for two people. So I don't like to say too much because I really like the patient to formulate their own opinion, and I think it almost has more of a wow effect in its subtlety. So sometimes what I often do is underplay it a little bit and tell them this is going to be a very, very subtle and natural effect, because the one thing you don't want them to do is think this is going to be, a really cosmetically changing lens, and then they can be disappointed by its subtlety. So I think, enthusiasm is good, but not to overplay it. So I'm very careful in choosing maybe 2, 3 adjectives at most. But basically, I'll stop myself after 1 or 2 things, and I'll say, look, I'm not going to say any more. Put it on, and let's see what you think. And I think that adds a little bit more excitement and mystery.
I agree. And the other thing that I think is really important that, people who are motivated by beauty, they care about what other people think. And so I think it's very important to send the patient home with some trials if they do like those. If they're not, they don't have the impact right away where they want to buy boxes on the spot. Because, not only, in my office, I pass the baton. When someone tries Define on, when they get to checkout, when they get to optical, I make sure I announce it to my staff. I tell them, Mrs. Smith is wearing the new ACUVUE Define. And so that way they can look at the patient in the eye and compliment them about the way they look. If they agree with it, they look well, just as they would with a pair of glasses when patients are trying on frames. But I send them home with trials because the first thing they want to do is take a picture of themselves and put it on Instagram or on Facebook. And so not only are they advertising for you and they're advertising your product, but they're also getting, answers from their friends and kind of getting that feedback in which they get more and more excited about their new eyes, and that helps with promoting not only your office but sales. So I think that patients who are, like I said, motivated by beauty really care about what their friends and family think and want to take them home.
Yeah, it works well. Also, I mentioned before about the optical. I don't know, Pat, if you have in your optical, but technology where the patient they get a split image or where they try different frames, they see their face in 4 frames. We will also use that technology while they're in the office, and they just have the lens on before they put frames on, and then they can, email it to their significant others or sisters, brothers, whatever. So, this way they can see themselves in the different colors as well. So we're now using our optical technology for the lens, and we're killing 2 birds with 1 stone.
Right. I was going to ask you that. When you give people trials, do you give them all 3 types typically when they leave?
Never.
No, never.
I only let them try on 2, and then if they like both or they can't decide, they get both. But if they haven't, we limit it to 1. We really try to do this in a very systematic fashion so that it really keeps the flow going. It keeps the conversation good but short and sweet. The one thing is you don't want to, you want to be able to get as many patients through, as many patients into the lens, and, you want it to be quality time.
Right. Okay, so now now it comes down to brass tacks here, how to recommend, which one that you're going to use. So maybe you could step us through, I guess, Sue, why don't you start maybe stepping us through how you actually choose?
Oh, yeah, well, it's very simple. I mean, I do exactly what Elizabeth said. So if they are, have an ethnic coloring, dark coloring, it's going to be the natural shine or the shimmer. If they have a medium brown to hazel eye, I will try the shimmer and a sparkle. And if they have a light eye, I'll mostly try the sparkle, but I may also try the shimmer. So it basically goes by how translucent their the natural color of their eye. And it's basically, I pick 2 that are closest. If I have somebody who has very hazel or light green eyes and they say to me they really want more of a dramatic, intense effect, certainly if they want to try the shine on, I don't have an objection to that. But I would encourage them to try the shimmer first, and then that might be an individual where they would try all 3. If they have a really medium eye, that could go either way. But basically, you learn very quickly which of these lenses, is going to go on, which eyes. If the patient has a very, very large cornea, like a very big brown eye, sometimes because the shine does increase the perception of the limbal ring, the eye itself a little bit bigger, sometimes it actually can look too big, so I will encourage them to try the shimmer and even sometimes the sparkle, because what it does is it gives a little bit more depth of color without making the eye look bigger. You don't want them to look, exophthalmic. So you want to keep the size of the eye, but just add a little bit more interest to the color itself. So, there is a little bit of, an art and a science here, but it's very, very simple to know, which color, you're going to choose. And the technicians learn it quickly. And pretty much I walk out with the patient and tell them, Okay, they're a minus 350. You're going to put a minus 350 sparkle on this eye and a shimmer on this eye, and that's basically, how we do it.
Right.
Yep. I have a question for both Patricia and Susan. Do you empower your technicians? For example, you may have a patient that is interested, but they are in a hurry to get back to work. Do you ever tell them, well, why don't you come on over after work, make arrangements with our technician, and then you can try them on, even though I'm not here?
I don't think so. Well, you know what? If they're already in a one-day moist, absolutely. If they're in a different brand, I probably wouldn't. I just can't remember having done that, Paul, so it's hard for me to speak to that.
Okay.
Sure.
Usually my technicians are gone before I am, so I have
Right.
That's the truth. Well, the one thing I was going to say about that is that typically if they're in for a contact lens exam anyways, I mean, they're there for the exam and there's kind of the time. I quickly will just grab the two lenses, and do an examining. But if it's someone that's never worn contact lenses before and needs a teaching and all that, and they don't have the time, then absolutely, they're more than welcome to come back at any time. And, a lot of, they can even bring a friend and, because a lot of times they want to have that comparison and to get the effect. So, it's funny that I said bring a friend because we had an event in our office in which we were promoting this lens because it was a brand new product. And, the natural instinct is that the person who likes this lens is the teeny bopper, because that's typically the demographic that we think of that wanted, that wants to enhance and, they're into colors and nail polishes and that sort of thing. So we had a 13-year-old girl who wanted to try the lens, and of course there wasn't much in effect because she was 13. She had a beautiful limbal ring, so it didn't look bad on her, but it just wasn't worth the benefit to, of cost for her. But Mom was sitting right there, and I asked Mom, I said, why don't you try the lens on? And the lens looked beautiful on Mom, and she said, I like it, but I'm not quite sure. But what was really surprising to me is Grandma turned around and she said, well, can I try this lens on? And, I kind of hesitated at first, because I looked at her and she was not the demographic I would even think of at the time. And she's like, I just had cataract surgery. I've never worn contacts, but, so her prescription fit the parameters, and she put them in, and she was so excited. She was the person that said to me, wow, I look like and that's what kind of guided me towards, the patients that have ARCUS, because she said, my eyes look like they did when I was 30. And that was an eye-opener to me. I never would have thought to think of someone that was in her 70s or 60s even, but the effects are so amazing that that it's wonderful, and patients get excited about it.
Yeah, you got to start reading more AARP magazines.
There you go. There you go.
You'll see everyone in their 70s wants action. They want to be younger too. So
70 is the new 40.
There you go. Only in Paul's dream. Okay. Okay.
The one thing I did want to mention, too, is some of the effects of when this lens is first on. Some patients will feel that they notice, a little bit of a shadow or ring around their vision. And it's kind of almost the same effect of when, you get a new pair of glasses and you're noticing the frame. And so there's some adaptation for some patients. So over a period of a couple days, they'll start that'll kind of dissipate, and they'll kind of get used to the vision in the lens. So it's not a bad thing if a patient does say, I'm seeing a little bit of a shadow, but they're still seeing, adequately, if their acuities are still good, go ahead and let them try it on and bring it home. And they, most of the time they will say that it dissipates. So I just wanted to bring that up because some patients will experience that.
Yeah,
Right,
and on that note, Paul, and I'd like to just bring up a couple of other things, just from the clinical and the doctor perspective, not so much from the patient perspective. So as I've been speaking to doctors, a lot of them say to me, well, what is it that now we only have one base curve? They're very upset with the fact that there's one base curve, but you have to understand the 8.5 base curve fits, 99.9% of the patients. This lens, and I've seen it even with the clear one-day moist, I rarely, if ever, needed the 9.0 base curve. And the other thing is that when you do have a cosmetic lens, you do want it to move a little bit less, for stability, both, for the cosmetic effect. But I can tell you the 8.5 base curve drapes beautifully on just about every eye. But that being said, you will actually see a little bit more movement of this lens on the eye. And it's not because it's moving more, it's just that you can see the movement more. With the limbal ring, it's much more dramatic under the microscope. So, take a look, make sure it's centering well with the microscope, but really step back away from the microscope, look at the patient as you would if you were just looking at them casually, a few feet away. Have them blink, have them look around, move their eyes. And if you're not seeing that lens move as a casual observer, then you have a good fit. So I just want to alert, doctors to the fact that the 8-5 base curve works and that it's going to look a little like there's more movement under the microscope, but that does not mean the lens is moving too much.
Got it. And this is a good segue to the fun scientific stuff. So let's talk a little bit, I guess, about parameters. So do you guys want to just run down the list and fill everyone in?
So yeah, I'd like more plus lenses, Elizabeth.
Yes, we've heard that there's certainly demand for additional plus power, so that's something that we're actively working on, and we will bring it to the marketplace as soon as we can.
But other than that, everything's great. Yeah, no, we have a lot of high myopes, so it's great that it's available to a -9. But I know it's funny that Patricia mentioned that older woman, and we do have a lot of middle-aged to older women now who are plus 250, plus 3, and these are the ones that are begging me for the lenses because they're the ones that want to look younger. They have the most disposable income, so they can, afford the lenses, but, I got to wait for the plus lenses. But as I said, it's in an 8-5 base curve. It's the same exact technology. It's got the Lacrion technology. It's class 2 UV protection. So it's your moist lens. And the one thing that I think we should all remember is that this pigment is well embedded in the material. There is no sensitivity, and there is they've done electron microscopic studies. There is no pigment that comes to the surface of the lens. So the coefficient of friction and the lubricity of the lens is identical to a moist.
Right. All right. So I guess, we were bringing up the disclaimers here. So I guess that means we're at the point in the talk with the few minutes that we have left where we can get some questions. So if everyone can see the box on the right side of the screen, if you wanted to ask any questions, I'm sure Patricia and Sue and Elizabeth would love to field some. So feel free to type some in, and we can
let me start with a question.
Sure.
Is there a differential in cost between the clear lens and this cosmetic lens?
Yes. So Define is at a premium to a clear moist. It's also a more profitable lens for the doctor if it's priced at our UPP than the clear moist. And I think what we found, and Drs. Poma and Resnick can speak to this, is that when you introduce this brand new beauty benefit, patients are willing to pay for that in the same way that they might pay more to have designer frames.
Okay.
Interesting. And I actually had another question too. You mentioned that you were sort of selling them the clear along with the regular supply of one-day moist. What do you think your take rate is for that in terms of your patients? Because I know that if you ever get the plus lenses out, hint hint, and I start buying these to supplement with my traditional one-day moist, I would probably wear these most of the time. I wouldn't want to switch back and forth. What's the sort of take rate that you've seen among patients who start wearing them?
It just depends on the patient. I mean, some patients don't wear makeup every day, and so they might not wear that lens every day, but put them on the days that they wear makeup. Or some might wear them every day because they want the minimal natural beauty effect on a daily basis. I mean, you can't really. I mean, the key is to just introduce it and let them kind of decide about how they want to wear it. I've had patients that bought your supplies on the spot. I've had patients that bought one box for for special occasions, for weddings and graduation parties and that sort of thing. So there isn't really a hard and fast rule on the whys and hows,
Right. How is the lens supplied? Does it come in 90 packs or 30 packs?
30 packs.
30.
Well, it's available in 30s and 90s.
Oh, they're available in the 90s now. Okay.
Okay. So 30s and 90s. Good to know.
30s and 90s. And what we found with patients in this lens is a lot of times patients might only buy a small supply with the thought that they'll wear it for just special occasions when they want to look their best, but it has a bit of an addictive quality. When you start to have people notice that there's something a little bit different, more striking about your eyes or your overall look, and then I think even more when you take the lens out at night and you feel like you're missing something, in the same way when a woman removes her eye makeup, she might feel like her eyes look a little bit tired and less enhanced. There becomes a little bit of an addictive habit. So you may find that patients start out wearing occasionally and then start to graduate to more full-time wear.
Right. And in fact, I have a question about that. This is always sort of a controversial question, but the whole compliance issues. Do you find that patients who wear this lens are as compliant as using a regular one-day moist?
It's a one-day daily disposable lens, so we know that that's by far the most compliant patient group out there. Honestly, the lens hasn't been in the marketplace long enough for us to have run any compliance studies to see whether or not there's a difference, but I would expect the same sort of compliance that you see with any other daily disposable lens.
Right.
Yeah, just like any other daily disposable, it's just important to educate the patient and remind them about the safety of wearing, the daily disposables just for one day.
Right. A question here, are the trials marked differently than the revenue lenses?
No, the trials are exactly as the revenue lenses. It's not like when they, tested teal lenses that said test on them or whatever. So it's exactly the same. So the patient can leave, and if the patient is, not sure, and as Patricia alluded to before, some of them want to go home and do the husband test or the wife test. Give them a strip for each eye. It's exactly as they'll be getting, when they deliver directly.
The trials are also powered, so that's something different
Right.
from what you see with most colored contact lenses. And we wanted to make sure that patients had a chance to see themselves and really experience the lens the same way that they would any clear lens.
Right. And Patricia, I think you mentioned before that you sometimes use this lens with patients who are just getting started with contacts because they're easier to handle because of the markings on them, because they're colored. Is that?
Well, yeah, they're able to find them in the case a lot easier. Yeah, absolutely. And then they put them on, and no one looks at their eyes more than who's first trying out contact lenses, and so they notice the effects right away.
Right. Okay. Yep. And so, a question here. I'm going to try to read it as best I can. It's do you have a harder time convincing dark-eyed patients that there's an effect versus light-eyed patients?
I don't, not at all. I was curious about that in the beginning because I wasn't quite sure. There are a lot of patients with dark eyes that almost have a dark, beady eye, and and we didn't really talk about that too much. But patients who have smaller corneas or beadier eyes, the effects are amazing. Their eyes literally shine. I mean, I know that seems like a pun, but it's nice on African American patients and dark-eyed individuals. Absolutely, there's a definite effect.
I actually thought it would be more difficult to take somebody with a beautiful, gorgeous blue eye and tell them we're going to make him look prettier. I find that a little more difficult. The brown-eyed people, they have an inferiority complex. They're easy. So, but I've been very surprised with how receptive my blue-eyed patients are. Because they understand that the blue color is pretty, but once I tell them we're not going to change their color, we're just going to make them pop more, they get it. They enjoy it. So, yeah.
Sometimes the shimmer will allow some of the blue-eyed individuals, it almost gives them a hint of green. So some people like having that different effect. The blue-eyed individuals might like having like a deeper, I don't want to say darker, but just a more dramatic eye to them. So, they're used to having the blue eyes, and it gives them more of a, and I also have, speaking of dramatic effect, I also have some patients that have blue eyes that might purchase or different varying shades, because they might have like a daytime look and then an evening look, because the deeper the shade, the more dramatic the effect, and so therefore they might in the evening or on that special occasions put something a little darker on, and then on an everyday, like as Sue was mentioning, going to the gym or your yoga pants days, just want a more natural look and stay with the lighter shades.
Right. And we're just about out of time here. We have 5 more minutes. I have a question for Elizabeth. Elizabeth, will you be showing off Define at the AOA, which is coming up very soon, I guess next week?
We will certainly be showing off Define at the AOA next week. There will be lenses available at the booth to try. So encourage anyone to come by and try the lens themselves or see it on a number of the folks that will be at the booth. We're also excited that we'll have our brand new one-day ACUVUE Moist multifocal lens at the AOA. So both of our newest innovations will be available to try.
Excellent. Well, I guess... Yep.
One last comment that I just want to make if you have patients, whether they have dark eyes or light eyes, and they're having a hard time kind of seeing the effects, I would encourage you to have the patient go and look at the lens in natural light. Unfortunately, these lenses are a little bit harder to pick up in some of the darker or fluorescent lighting that we see in a lot of optometric offices. But if you have your patients move to the front of the office where you may have some windows, natural light, warmer light, that's where you're going to really see the most impact for the lens.
Great. Well, we're just about out of time, but I want to thank Sue, I want to thank Patricia, and I want to thank Elizabeth, and I even want to thank Paul for staying here. And as usual,
Excited.
My sidekick is here. So, yeah, if everyone's going to be at the AOA, definitely stop by the booth and check the lens out. And if you have any more questions that we couldn't address tonight, this archive will be on ODwire. And so you can come back to the site, watch this webinar again, and ask questions, and we'll make sure to get you the answer. So thanks again to everyone for coming, and I guess I'll see everybody online.
See you online.